All right, good morning, everyone, and welcome to episode 87 of the On Air Advocate, where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate, and I am super excited if you are here this morning visiting with us or whether you are catching this on the replay. Now, as always, if you think any of this content could be relevant for anyone within your circle, your network, please make sure that you hit the share button and share the love. Or if you're watching from Instagram right now, you do the same. Now, as you know, the month of October is just filled with different months of celebration in different categories. So today I'm excited to have Dr. Miller here today, and we are going to be covering National Physical Therapy Month as well as National Chiropractic Month as well. Now, for those of you who have not met Dr. Miller before, Dr. Miller is a chiropractor. She is the owner of Miller Sports and Wellness, and she also sits on the American Chiropractic Association Editorial Review Board. So with that, good morning, Dr. Miller.
Good morning, Tammy. It's so great to see you again.
It's so great to see you as well. Now, I know that you sent me a very interesting topic, and so I just wanted to reiterate this quote that you gave. It said, if the only tool you have is a hammer, everything tends to look like a nail. And so I would like you to elaborate and tell everyone all about it.
Absolutely. Well, I've heard that quote numerous times, and it's actually attributed to numerous people. But that quote is something that I just feel is very, very true in medicine. So often, information changes so quickly, and patient care changes so quickly, and every patient is individualized and different. And what happens is you go into a provider, and they have a toolkit. They have a box of tools that they can use on you. And different professions have different tools. And so often we have the patient come in and we try to make that patient fit in our box. So if my tool is a hammer and the patient comes in, I try to make them look like a nail. And I try to make them fit my toolbox instead of trying to make my tools fit the patient. So identifying, is the patient a candidate for my tools, or are my tools the best candidate for this patient? And then if not, what other tools do I need? What other professionals do I need to work in with? And where do I need to go? And so it's a big thing that I strive for in private practice, and I really try to educate my patients on that. They need to advocate for themselves, but they also need to find providers that are willing to refer them out or coordinate care, because no one provider can do it all. And so finding a team and a tribe of providers so that you have the most tools available, so that if your problem is a screw, you can use a screwdriver versus trying to use a hammer every time.
Right. And I'm sure you see such a vast array of different things that come into your office that sometimes chiropractic care is what is the perfect fit. Sometimes physical therapy is where they need to go with it. And, utilization of different, modalities and all of that. Do you see that am I right on that quite often?
Absolutely. There are numerous times in a day where a patient comes in and maybe adjusting, which is the bread and butter of chiropractic, maybe adjusting is the best tool for them. But I have patients that I don't adjust for various reasons. Maybe it's not the best tool. Maybe it's something that makes them hesitant or nervous. So we talk about the research. We talk about the science behind it. We talk about safety and efficacy and that kind of thing. But maybe it's not the right tool for them. And so then if I have the tools, we use them. If I don't, then I've built a network of people in my community that we can quickly get on the horn and get the patient triaged to wherever they need to go. And the important thing about that is it gets really tough when you're in private practice. You're busy and you're wearing so many hats. It gets tough to not only maintain those relationships, but build new relationships and stay on top of what's coming out, because research changes all the time, and techniques that were top of the line and cutting edge 5 years ago are still good, but there may be differences or changes or better things. And so if I don't know what a PT down the street is learning, and I don't know what new techniques they're up on, then when the patient comes in, and that could be the best place for them, I need to make sure that I'm staying on top of that. And so that's where it's really important to find somebody that values that and works hard to build that relationship.
Would you say, because I mean, I think that the core of so many things is having a very, very effective medical team, knowing when to hire and fire doctors. I do a whole speaking segment and class on that in itself, because I think that those are your advocates, those are your allies, those are the people that are going to put you at the top of their list to make sure that your care is at the best that it can be. Do you feel like if folks are walking into doctors' offices, chiropractic offices, and they are not having anyone talk to them about different options, different doctors, this might not be the right fit, do you feel that that should be a red flag? I mean, should that be on your list of things, as you being a good consumer, going out, looking to build a good medical team? Is that one of the top, 5 things on your list that you should be looking for?
I would say it is, but I wouldn't put it quite into red flag. I would maybe put it into yellow flag.
Okay.
Most providers have kind of what we call a differential diagnosis list, meaning that in our brains, we're kind of walking through, this is what I'm pretty sure is going on with the patient, but I'm also paying attention to B, C, D, and E down the list. But some providers are more articulate about communicating that with patients, and some providers are not. And same thing in terms of treatment plan. I think the number one thing is your treatment plan should have a start, an end, and some goals. So when you walk into that provider's office, they should be telling you, this is what I see that we're going to attack, or this is what we're going to work on. Mm-hmm. I expect it to take 2 weeks, 2 months, whatever, and I expect to see 50% change, or I expect to see, whatever. If your provider's not communicating that, and they're not giving you a start, an end, and a way to measure your change, that to me is a yellow flag. Then you as the patient need to go to that provider and say, hey, we didn't talk about this. Can you explain it? If they cannot give you an answer, or they just say, well, we're just going to try, 1 visit a week for the whole year, and we're going to hope things get better, that would be a red flag to me, and I would be looking to move on to another provider. If they come back and they can answer that, then they may just not be as articulate at explaining it, and then you as a patient just kind of tag that in your mind that you might have to dig some of that information out.
Okay. Now, we are in the month of celebrating, obviously, National Physical Therapy Month and National Chiropractic Month. Can you tell the audience really the difference between physical therapy and chiropractic care? Because I think sometimes that gets kind of mushed together. Like, I need a therapist, I need a chiropractor. What does each job actually title and entail and service, I guess?
Yeah, so a lot of it depends on the state, partially, because at least for chiropractic, our scope of practice is controlled by the state. So how I can practice in Wisconsin is very different than how I can practice in New Mexico or Illinois or Michigan or other states. So that makes it very tricky. But from an umbrella statement, the two fields have been at battle with each other, and then we've also been kind of coinciding with each other for a long time. And chiropractic, the bread and butter, or the thing that strings chiropractors together, is what we call the chiropractic manipulation or an adjustment. However, we're not the only ones that can do it. Osteopaths can do it. Some physical therapists do it. So it is something that all chiropractors are trained in, and trained in heavily. I would say that we are kind of the experts in joint manipulation because it is our bread and butter. But other professions can do it. On the flip side, physical therapists, their real bread and butter is going to be kind of the rehab or the therapy kind of side of things. That being said, you have divisions. You have people that do outpatient musculoskeletal. You have people that do inpatient stroke victims. So there's different specialties kind of within PT. Now, other professions outside of PT can also do rehab. For example, in chiropractic, we have what we call diplomates, which are continued areas of study in rehab. So you have chiropractors that do rehab. You have physical therapists that do manipulation. And ultimately, what it comes down to is the two fields kind of take two different approaches to an end result. And sometimes, depending on the provider within that profession, they overlap quite a bit, or they're very different. And it all depends on the provider, the state, and kind of how people practice.
And when you're saying that, especially for someone, let's say that they have a new onset of an injury, that could be very complex to figure that out. And especially like you're talking about having that great medical team and a doctor coming in, and sitting with you and saying, hey, this is the plan of care. This is where I think you'd go. Because how would I know the difference between this physical therapy place is better at this and this one's better at that? And, because a lot of times we just think general physical therapy, but obviously if it's not targeted and specific and not someone's specialty, you may not have the results that you're looking for.
Yeah, and that makes it incredibly difficult for patients, and it makes it very difficult to know who to seek access or who to seek care from in terms of access first. I would say, in some states, physical therapists cannot write scripts for imaging. So if you need MRIs or x-rays or that kind of stuff. So if you're in a state where a chiropractor can do that and a PT can't, then oftentimes I would say seek the chiropractic care first, because if you need imaging, it streamlines it. That being said, there are states where that is reversed. So if you're in the reverse in a state, then you probably want to seek care from a PT first. So one thing that I would recommend, that is one thing that gets, can help you kind of clarify, is if you just Google, state of Wisconsin, chiropractic scope of practice, and then state of Wisconsin, physical therapy scope of practice, the Department of Regulation in each state will put that information out there. And so you as a patient don't know if you need imaging or if you need, whatever. But if you start with the person that has the most open scope, then they have those tools in their toolbox that they can utilize. And then if you go in and they say, hey, I'm not the right person for you, you need to go over here, then they can triage you. But again, it kind of goes back to that hammer quote that we talked about.
Right. And I don't think, we are both in the state of Wisconsin. And in the state of Wisconsin, I don't believe that physical therapists can write x-ray or imaging. And I don't think so. I mean, because I've been to a million of them and they've never been able to. So they've made referral. They've made like suggestions to the doctor saying, I think you need to be imaged. I think you need this, but never. So we are not a state here, Wisconsin. So what are the laws in Wisconsin for people who are listening from here?
Yeah, so for chiropractic, we have a pretty open scope of practice. We can treat head to toe musculoskeletal, so it's not just spine. It can be ankles and feet and shoulders and necks and headaches and everything else. We can do full diagnosis. We can do full imaging. I can write lab work. So if I need to send you for x-rays, MRIs, lab work, any of that kind of stuff, I can do it. The one exception to that is Medicare. I have the scope to do it, but Medicare will not pay for it. So we have to send you back to your primary care provider in that instance. And I can do all of that different kind of stuff. In Wisconsin, some chiropractors can also do nutrition and supplements. Some cannot. That is an additional certification that you have to have. In Wisconsin for physical therapy, on the flip side, it's in their training to know if you need imaging, and they're screening you to see if imaging is in your best interest, but they cannot actually write the script. So they have to send you back to your primary care doctor, back to a chiropractor, back to an orthopedic, back to somebody else to get you that imaging. I also do not believe that they can write lab work for looking for autoimmune conditions or that kind of stuff. I have to clarify on that point, but I don't think they have that scope in Wisconsin either.
Okay.
So in Wisconsin, we're more or less full primary care providers, with the exception that we do not prescribe medications.
Okay. And you were saying for Medicare, what about for like Medicaid? So in that instance, if you need blood draws, if you need other x-rays, that goes through the primary. But will Medicare, Medicaid, will they a lot of times cover actual service though, the chiropractic service itself?
Yes. So Medicare is kind of tricky on that. It depends on supplementals and secondaries, but Medicare will cover baseline exams and adjusting. So if you come in and those are the best tools in your toolbox, then those are covered pretty extensively for you within a reasonable treatment plan. But if you need other services, let's say you come in, like if you came into me and I determined, well, adjusting isn't maybe our best technique. Maybe we need some rehab, or maybe we need some tissue work, or maybe we need a combination of those. The other services we can submit to Medicare, but they usually pass that charge along to the patient. Some secondaries or supplementals will pick that charge up. Many of those say, nope, if it's not a covered service under Medicare's underwriting, then we won't cover it either. So That's a great question to ask. If you're a Medicare or Medicaid patient, I believe Medicaid is the same. If you are a Medicare or Medicaid patient, ask the office how they typically handle it, what they typically see covered, and what options they have for your best pricing. For my office, we make it an option available to patients to submit those other charges through Medicare. But since most of the time it's not covered, I give the patients the option to pay out of pocket for that at a reduced rate, because now I don't have to spend time, money, and staff costs to send that out into Medicare. So I can give the patient, I can pass those savings right along to the patient.
Okay, that is awesome to know. Now, I know before the segment started, we also talked about, because like I said, this month has like a plethora of things.
Yeah.
It is crazy how many different organizations raise awareness in the month of October. I'm like, we need to spread this out just a little bit, but it's a wonderful thing, because the only way that people learn about different things and that awareness and education is built is from these campaigns being put on and it being pushed into the community for people to learn and educate themselves more. But we are also, this week, we are in National Health Education Week. And so with that being said, I think that all the segments that I've done this week, I just like to gather a few tools that could be in the toolbox, a few reminders that we should be doing just for our own health and well-being, knowing that we are in fall. We are, I don't know how many Sundays or Mondays away from Christmas. I don't know that I want to know, but it's pretty close.
It's coming up fast.
And that stress and sometimes all the eating and family and emotions we were talking about the other night are just very much prevalent. And so I just want to find out any quick tools in your toolbox for, wellness for all of us that we can take away with today.
Yeah, I think I've got a couple for you, but I think the number one I have is to get moving and keep moving. The reality is that from a musculoskeletal perspective, your tissues get nutrition from movement. So with as sedentary as we are, and especially if we talk about caregivers or people caring for loved ones, the hardest thing in the world is to take care of yourself. But your tissues get nutrition from movement. So in order for your tissues, your muscles, your ligaments, your joints, your cartilage, your discs in your back, in order for them to get nutrition and in order for them to stay strong and healthy, they have to be moving. And it really doesn't matter what you do. Find an activity that you enjoy, whether it's going for a walk, going for a hike. Make it a social thing with friends so that you don't have to spend more time doing it. You can work it into your lifestyle. Instead of meeting a friend for coffee, maybe you meet a friend for a walk, or you pick up coffee and you go for a walk. But getting moving is the number one thing that you can do for your tissues. It also has big, big connections to brain chemistry. So reducing anxiety, reducing depression, improving mood, helping control energy. Let's talk about weight loss. Let's talk about controlling appetite. So many different factors.
Right. It's just
getting into the stress. You want to control that mental aspect. Getting moving is by far the number one thing that I think people can do for themselves.
Dr. Miller, I wish that you'd put that like on a banner, like somewhere that says get moving, because I say that so much to others. A lot of times, even when I work and sitting in doctor's offices, people are like, you're crazy. Like you're walking the stairs, you're walking around. And I'm like, I actually feel horrible and my body hurts. My lower back hurts if I just keep sitting. So, even though I'm exhausted, like I feel like I need to stand, I need to move. And that's why, because, your tissues aren't getting any nutrients if you're not.
Exactly. And one thing just to kind of add to that, there's been a new movement for sit-stand desks, which are awesome to be able to get out of that sitting position. But I'm going to make a prediction that in the next 5 years, they're saying sitting is the new smoking. Right. I'm going to predict that they're going to say standing is the new sitting. Just standing at your desk, while it's good to get into a different position, standing in one position still doesn't give those tissues the nutrients. You're just loading different tissues. So right. If you're on that bandwagon, if you've gone to sit-stand desks, that's phenomenal. And I do recommend them. But I would say, kind of keep in mind. You need to be
like marching.
Yeah. You need to do something that's still kind of moving. Yeah.
So the ones that are really positive with that is that if you have the desk over a treadmill where you can be walking,
And moving,
while
yeah.
you're moving. You know, I did one day where I was just doing work on my iPad and I went slowly on my treadmill.
Yeah.
I ended up burning 900 calories and walking for 4 hours.
Yeah.
And it wasn't fast, that I was going, but yeah, definitely that movement. And I can see that if you're just standing, that also doesn't it put vascular pressure?
Mhm.
Also,
Yeah.
so that's why they're saying that you need to actually be moving your limbs as well.
Absolutely. Yeah. And then the other thing that I'd like to say in terms of just health education is so many times we are extremists. I think it's human nature that, we can cut sugar entirely and do a 30-day sugar detox, but we can't control it in moderation on a day-to-day basis. People jump on workouts January 1st and they go great guns until January 30th, and then they don't do anything for the rest of the year. By human nature, we are extremists. And one thing that I would really encourage people is pick one small thing that you can do, just one to focus on, and try to build a habit out of it. And maybe you pick one a month or one a week. It kind of depends on your personality. But if I know that I really struggle getting good sleep at night, then maybe for the whole month of October, I make a focus to making sure I get to bed at a reasonable time, and I try to build that in as a habit. And I don't move on to drinking more water or, changing my diet until I've built that habit. And then you want to really look at it as a lifestyle change. Make small changes that add up to a big change instead of doing something really extreme that you're not very likely to stick to, and then you yo-yo back the other way. You're better to make small changes and build a foundation than you are to do something extreme and then you don't see your weight change or you don't see your health change immediately. You get frustrated and you fall off, or you get busy and you fall off.
Right. Well, Dr. Miller, I definitely in January, we're going to have a huge fitness wellness month, like caregivers, everyone, whether you're a caregiver or you're not, we just need to be healthy for 2019 coming up. So hopefully, think about some different tips and exercises and whatnot for that, because I do think that's so relevant too. We all start things. We hear about new diets, we hear about new fads, and then we're going to do it, and then we're going to take the pill, and then we're going to take the shake, and then it's done.
And then you fall off. Yeah.
And then like 2 months later, it's done. So it's active exercise on a daily basis, whether that's walking, running, movement of any kind, like you're saying.
Yeah. And knowing your why, why are you making these health changes? Is it so that you can be a better care provider for your loved one? Is it so that you can take care of your health so that you're there for your kids when your kids are older? Is it just because you've kind of hit that rock bottom point where your energy is low and you're not happy with where your body, your health, your emotions, everything are, and so you know that you need to make the change? And if you focus on that why, on that end result, right, it's a lot easier to weather the ups and downs as they come and go.
Right. Now, you are also telling me there is some movements going on right now that people should know about for this month of October, right? For National Chiropractor Month, and I don't know, physical therapy. So can you fill the folks in all on that?
Yes. So the American Chiropractic Association is the organization that's really kind of behind National Chiropractic Health Month. And they're using the hashtag #MoveForLife with the number 4. Again, it kind of goes back to my tip, but I definitely see eye to eye with them on this one, that their big initiative is to bring education about chiropractic, but also to help educate people about how important movement is to their general health, so that whether you're seeing a chiropractor, a physical therapist, or somebody else, that you're getting that going. So if you check out that hashtag on pretty much all the social media networks.
And can you drop that when we're done below in the comments on this
Sure.
Facebook feed so that people have it so they can use it? So with that hashtag, are they asking people, like if you're doing an activity, if you're walking with a friend, if you're at the gym, anything that you're doing movement, healthy for yourself, you should hashtag that, put a picture up or whatever it may be?
They've got a couple different initiatives. So if you're doing different movements and you're working it into your life, tag it so that you bring awareness to it and help people see new ideas or different ways to add it in. Also, if you want to search it, a lot of chiropractors are putting information out there as free and kind of diverse information for people. So from an education standpoint, so a lot of chiros that are on board with this or that are ACA members are tagging that in their posts. So it's a good way that you can find free, relevant,
good information.
as well.
Okay, perfect.
Yeah.
And then for Miller Sports and Wellness Center, is there anything new coming up for 2019? Anything we should be watching for? I know that you do put out informational content on a regular basis. Can you share with the audience, one, how they could get that information, and if there's anything new and upcoming for you guys?
Sure. We have so many cool and exciting things coming up. So the best way to get in touch with us is through Miller SWC for sportswellnesschiropractic.com. That's our website. You can also find us on Twitter, Facebook, and Instagram. But if you go to our website, you can link into those. We put out tons of information, a lot of free resources, links to different techniques, different providers, all that kind of stuff. Again, trying to build that toolbox for patients so that patients at least know what to look for or what questions to ask. So just this year alone, we have added a mindset coach that's helping patients with mindset. So if you've had an injury and you need to get back to activity, or maybe your hip hurts and maybe you need a hip replacement, but you need to get moving to lose the weight. So we've added mindset coach. I have a dietitian joining my team next month.
Nice.
We also have several other providers that are going to be joining our team as we kind of get moving. So our goal is to really develop a multidisciplinary team so that we can all work together and all put our tools into one big tool basket for patients. Not every patient will need all of them, or maybe even several of them, but our goal is to be able to triage patients. So definitely lots of cool stuff happening and good stuff to be looking for.
That is awesome, because it's so nice to be able to go somewhere that it's so comprehensive and that the things that you need, and especially if they entrust in you and you have built them already a strong medical team, that they don't have to leave. I know, for myself with going to millions of doctor appointments, it's nice to be in the same family
Absolutely.
of doctors than running all over the city for different things.
Absolutely. And if we're already coordinating care on multiple cases, it's easier for us to have that 5-minute conversation instead of, I have plenty of providers that are out in the community, but then you've got to find that 5 minutes where neither one of us are with patients or busy, or it's harder to find that time aside.
Right. And that continuity of care is so much more strong because everyone is in sync with each other, and you're not having doctors that miss something along the way in translation. So
you don't even know to look for something, because when you talk about a case, they kind of say, well, did you consider this? Oh, that was off my radar because that was outside of my specialty.
Right.
Yeah, so we're pretty excited. Lots of good changes.
That's awesome. And I'm going to have, I'm going to drop the website below, but then if you guys want to drop any of your social media or your latest blog or anything like that, you can drop that below within this feed, just so that everybody has it right at their fingertips for them to listen to. And just some information before we wrap up today that I wanted to share. I was sharing with Dr. Miller. It's so exciting that this week we are going to be kicking off our Caregiver Celebration 2018. As you guys know, National Caregivers Month is next month. It is also the On Air Advocate's 1-year anniversary, and it will be our 100th episode of the On Air Advocate. It will take place in the first few weeks of November. And so we are putting together a campaign for you guys to get involved with some fun activities that are also going to have some giveaways. So just stay tuned. It will be out by the end of this week, all the different stuff. So super excited. I wanted to share that today before we get off of the air, just so everybody can stay a lookout for that. And anything else, Dr. Miller, that you'd like to leave us with? Any last thought?
No, I just want to say thank you for hosting this. This is a great resource for people, and I'm so excited to be a part of it.
Oh, well, thank you. And we look forward to having you back on again. We're going to drop all of our information below. If you guys want any more information about the On Air Advocate and the On Air Advocate services, you can head right on over to onairadvocate.com and you will find it all right there. Also, if you would like to become part of our private community, you can head right to the top of this Facebook page, hit the blue button, and request to be a part of our private group. So on that note, you guys all have a fabulous Wednesday morning. And it's a double header over here today at the On Air Advocate. So make sure that you tune in later on this evening. We'll be chatting with Dr. Therese. She is a naturopathic physician from Arizona. So make sure that you guys tune back in. All right. Thanks so much, Dr. Miller. We appreciate it. Bye-bye.